Hi, Dr. Desmond White, gastroenterologist. This is part 3 on hepatitis A. I've covered the epidemiology, how we get Hep A, the transmission. I've talked about the symptoms and the diagnosis. Now I'll talk about the treatment. Actually, there's no treatment for hepatitis A. There's no medicine that we give to the patient to suppress the virus and make them well the next day. No, we will have, in fact, most of acute viral hepatitis, there's no treatment. Even acute hepatitis B, there's no treatment. There's no specific antiviral treatment. But our treatment is mainly what we call management. We follow the patient to make sure they don't belong to the rare 5% that go to liver failure. If they do, we quickly transfer them to liver transplant center for liver transplant or for other treatment like liver dialysis. So we would manage them, monitor them. We tend to take the blood from them to check the liver function and the bleeding time every day or every other day until we get the diagnosis and until we see them turn around. So the management needs support, and I put my patient on a drip because they often have no appetite, they vomit, they don't feel like eating, and they're dehydrated. I put them on the anti-vomiting medicine to suppress the vomiting feeling if they have. I put them with on a laxative because they are often bloated, they cannot pass motion because they have hepatitis A, and if they have a clotting profile abnormality, I put them on intravenous vitamin K to help to see if it can help the clotting time to be normalized. And there's some medications such as S-adenosine methionine, SAM, or ursodeoxycholic acid that we can give to the patient to help the liver improve the jaundice faster. So I put them on all these patients. But the main thing in management is just to confirm the diagnosis. Once it's confirmed, usually it's okay. And the several group of patients that are worse off in hepatitis A. The first is older people. Actually, I did a study when I was in NU more than 20 years ago. We just did a hepatitis A IgG. That means to see whether they have been having Hep A before. We found out that if in Singapore, 20 years ago, if you're younger than 40 years old, you could have been exposed to Hep A without knowing it. So a young person that gets hepatitis A, they recover without even knowing it. How do we know they have gotten it before? Because they have never been vaccinated when we ask them, and on the blood there's a marker called the anti-HAV IgG that is positive. So we know that they have been exposed before without vaccination. So they must have been exposed to the real virus and recover without knowing it. So if you're young, like you're younger than 40 years old, you may have gotten the infection without knowing it. The good thing is you can only get hepatitis A1. You get it once, you recover fully. Okay, so young people get Hep A, no problem. They don't even know it. But when you're older, like I'm 50 plus, you're 50, 60, 70, then you can have a lot more symptoms. The older we are to get hepatitis A, if you're not vaccinated, you can get a lot of symptoms like feeling very tired, feeling being jaundiced, they have no appetite, cannot move at all, super tired kind of thing. Okay, so your age matters. Number 2 is any chronic liver disease. There's a very famous study published in conducted in Shanghai, I think many decades ago. They find that at one time there was a hepatitis A outbreak in Shanghai, and some people die, most don't die. And they find out that if among those that die, mostly they are Hep B carrier, because hepatitis B was prevalent in China many decades ago, so that could become an opportunity to study hepatitis A. So the rule of thumb is, if you have any chronic liver problem, such as alcoholic liver disease, liver cirrhosis from any cause, hepatitis B or C, please vaccinate against hepatitis A before you get it. Because if you have underlying chronic liver disease and you get acute A on top of that, you may be much worse, and the chance of you dying is estimated to be 5 times higher than people that have normal liver. So people with chronic liver disease have higher risk of a problem. People having liver cirrhosis, hardening of liver, also have higher problem. It's like your liver already damaged by whatever cause. On top of that, you get an extra hepatitis A, you make the liver much worse. So how can we prevent hepatitis A? Well, the simple answer is vaccination. There's a Hep A vaccine available. You can get it done in a GP clinic or a polyclinic, or go to a Healthcare SG, a partner clinic to get it done. It's 2 injections, 6 months apart. They provide protection for close to 100%, super high rate of protection. So if you haven't had Hep A before, do go to your GP, go to the polyclinic to have the Hep A vaccine. They are not expensive, and they can prevent you from getting hepatitis A. That's all from Dr. Desmond White on hepatitis A. Hope you learned something from me. Good night.